Hello, my name is Allana. I am a student in the second period of the radiology course at UTFPR. This is my work for the anatomy class with Professor Katia, and I will briefly talk about fibrodysplasia ossificans progressiva.
I will make a quick summary about the disease, which will cover all the things I believe are useful for better understanding. I wanted to emphasize that unfortunately I cannot talk about a specific system of the human body. For example, it only affects the circulatory system, because the disease affects all systems of the body in the long term. The human skeleton has an average 206 bones that are essential for the support and protection of organs. However, imagine that due to an extremely rare genetic alteration, some people start producing extra bones in their bodies. Fibrodysplasia ossificans progressiva is a rare disease in which, over the course of life, a person begins to develop bones inside muscles, tendons, and ligaments. These bones compromise the joints and make movements increasingly rigid, hindering the patient mobility. The causes of this disease are not exactly known, nor the process by which tissues turn into bones. But we know that it occurs due to a genetic mutation of the ACVR1 gene, which encodes a protein known as type 1 receptor for bone growth factor. Up to the present moment, the reason for this mutation is not well understood, but it is believed that in most cases it occurs without any family history. Although in some cases it can occur through autosomal inheritance. In other words, it is passed from parents to children. FOP presents its symptoms during the childhood. The ossification process usually begins by the age of 5, but the transformation of tissues into bones continues into adulthood. The age at which the diagnosis is made can vary. In the most cases, the child is born with the big toe smaller and turned inward on both sides, which may closely resemble a bunion, but it's not. Here we can see how the growing bones have affected the shape of the patient's spine. On the side, we have an X-ray of a cervical spine, where it is possible to see some ossifications, as well as an ossification in the arm that may have occurred due to an unintentional impact. The first signs usually appear in early childhood with malformation of the toes, spine, shoulders, hips, and weak joints. Other symptoms can appear until the age of 20, with the main ones being reddish swellings throughout the body, which, upon disappearing, leave bone in the affected area. Development of bones in areas of impact. Difficulty moving hands, arms, feet or legs. And blood circulation problems. The disease usually progresses due to traumatic factors such as falls, surgeries, impacts, high-impact physical activities, and even vaccination, but it can occur for no apparent reason. This results in a process of muscle inflammation, which can lead to the death of muscle fibers, causing bone to form in their place. This disease affects approximately 1 in every 2 million people, making it an ultra-rare condition. Approximately 800 cases have been diagnosed up to the present moment. In Brazil, there are around 102 diagnosed patients, according to a survey conducted by the Brazilian Association of FOP. Diagnosis is often delayed and difficult to achieve. Due to its rarity and consequently less studied, some patients take years to receive the diagnosis because doctors are not prepared to identify the condition early on. The observation of characteristic symptoms is an important diagnostic criterion. In addition, tests such as X-rays, computed tomography scans, and magnetic resonance imaging scans can also be used to help confirm the diagnosis. It's essential that the diagnosis be made by specialist doctors, such as orthopedists or pediatricians, as tests such as a biopsy can cause minor traumas that would lead to development of bone in the area, potentially worsening the patient's condition more quickly. Unfortunately, fibrodysplasia ossificans progressiva currently has no cure, so it is common for some patients to become confined to a wheelchair or even to bed after the age of 20. The main goal of treatment is to improve the patient's quality of life and prevent possible complications. Due to the stiffness and decreased mobility caused by the ossifications, it is very important to undergo physical and occupational therapy. In cases of intense pain or inflammation, anti-inflammatory drugs and analgesics may be prescribed, but they should be used with caution. There are more severe cases that may require surgery, but these procedures can lead to the formation of new bones. It is also essential for the patient to maintain good oral hygiene, as any necessary procedure can lead to the formation of new bones. In the images on the side, we can see demonstrations of how the bones and muscles of a person without this condition look and how they differ when the person has it. Here are the references where I got the information for the text and the links where I got the images. I hope you enjoyed it and thank you for watching.